Okay, so we're here with a whiteboard to give a little bit more sense of it. What are the things that we're going to be looking for on the back when we're palpating it? May it be a seated person or a face down lying person. So I'm going to try and do my best artistic skills to point out those body landmarks that we're going to be looking for as we're palpating um, to get ourselves comfortable with where we are on the body. Okay, so if we have a person, let's say his head is here. Okay, say 2 ears, and we're looking at the back. That's his posterior hairline. You can argue that he has a neck, and then roughly talking about the contour of his shoulders. If his arms are nicely like next to his body, let's just put it like around here. Okay, I just want to get the proportions correct. And if we were to look into the gluteal folds to be around here and around here, these will be the legs going down. And our target area would be what we like to say, well, we have a little bit of that cracks here. So this is where the sacrum would be around. The hiatus of the sacrum is here, and there's a little bit of a coccyx that is like a small tail that goes underneath, okay? The spine, we have the cervical spine that goes from the end of the inferior aspect of the skull. We have 7 segments all the way to about here. And then we have about 12 segments that go around here. Then we'll have the 5 lumbars right there. So let's just, for sake of, let's say, palpation, I'd like to also give the contour of the body. So let's say it's about there and right there. So what's important is that we want to be able to define that area, what we call the lumbosacral junction, which is right there. And the bottom of L5 spinous process is going to be right there. So if we have bottom of L1, the bottom of L2, the bottom of L3, the bottom of L4, and then the bottom of L5. So we're also going to be wanting to find those, what we call posterior superior iliac spine, which is right there, okay? Same level as L5. And we want to be able to then find the bottom of T12, okay? Which makes that to be the floating rib right there. That's basically where the rib cage begins when we go inferior to superior, okay? So that's important. Here we have the shoulder blade. It's important that we recognize that they have a spine. The shoulder blade itself has a spine, and they sort of like run around like that. That's the acromion, which is the bony landmark we can feel. Let's do something a little similar here. Maybe not as symmetric, but you guys get the gist. All right. Yeah, let's make it a little bit more symmetric right there. Okay. Now, we have the midline going here, right? We have 1, 2, 3, 4, 5, 6, and then 7 right there. And then we have 12 going down here. So that would be around T6, and then T3, T9, and then T12. Just trying to keep the proportions. When we are about to palpate, we want to be able to see the peaking of the crack, if you will, between the glutes. That tells us where the end of the coccyx is, and then we have the sacrum, and then we can glide north, so to speak, or superiorly, to find that little, you can say, valley between the L5 lumbar and the sacrum. To make sure we're right there, we can then take 2 or 3 fingers and then palpate about 1.5 to 2 tsum lateral. We're going to be able to find the top of the mountain somewhere around here, and that should be about the same level as L5. That's really helpful. Same on the other side. We also want to be able to continue the line of the iliac crest, if you will, that goes symmetrically to both sides. So that line we want to be able to palpate. That leaves us about usually 2 to 3 fingers. Men usually are higher in their pelvis, So there's less space between the 12th rib, if you will, or the rib cage as a whole in the iliac spine. Women sometimes can have like 4 or 5, maybe more fingers between them, okay, because their pelvis is wider and lower. Okay? And then we want to be able to just recognize that up here, the first cervical rib is going to be like if this is the bottom of T1, because this is the bottom of C7, the first rib is going to come from that space. That's why I wanted to draw that for you, because that means that when you compress the soft tissue down, and let's say we take another color. Let's say this is my hand. See how the green goes. When I compress it down with my fingers, okay, like this is my pinky finger, third, etc. When I compress it down, everything that is below my fingers is going to necessarily be like there's no rib above my fingers, let's put it that way. So it has to be below that line. If we find with our palpation of the spinous processes that we are like we're not sure is it C6 or C7 or T1, you can always go one more, and then you ask yourself, could a first rib fit inside that space? If the answer is yes, you're probably at the bottom of T1, and then you have to go back so you can confirm that you're on C7. Okay? C7 roughly meets the same level as the acromion. Okay, roughly. It's not always correct, but you'll be able to find it around there. And that's super important because we want to be able to know where we are. There's a lot of points that we use from that sort of like location. So T1, bottom of T1 is here, so bladder 11 is going to be right there. If that's our 3 soon line, halfway is 1.5 out, right? That's bladder 11. T2, bladder 12. T3, bladder 13, the back shoe of the lung. T4 is the bladder 14. Bladder 14 and 15 has to do with the pericardium and heart. And then we have 16 and 17. I just wanted to make you guys aware about how to approach the palpation so you guys know where you are. I hope it was helpful.